This is a Chronicle podcast, bringing you ideas in the service of medicine.
From the Chronicle podcast system, this is a Skin Spectrum podcast for April 20th, 2022. It's Yadav on Acne, with Dr. Geeta Yadav. Based on recent publications from the clinical literature, Dr. Yadav provides brief synopses of recent significant clinical developments in acne research, and provides her observations and comments to accompany each report. In each episode, Dr. Yadav will answer questions and offer her expert observations and anecdotes on treating this disease. If you have a question for Dr. Yadav, or want to be in touch at any time, just send an email to yadav@chronicle.org. That's YADAV@chronicle.org. And, if you attach a voice clip, we might even use your question on an upcoming episode. Support for this podcast comes from Cipher Pharmaceuticals. Cipher is a specialty pharmaceutical company with a robust and diversified portfolio of commercial and early to late stage products. Cipher currently markets dermatology products directly in Canada and indirectly through partners in Canada, the US, and South America. Visit them at cipherpharma.com. And now, here's John Evans.
Thanks, Leona. Welcome to the first episode of the Yadav on Acne podcast with Dr. Geeta Yadav. I'm John Evans, Senior Editor at the Chronicle of Skin and Allergy. In this episode, Dr. Yadav will talk about some recent studies on hormonal acne, its causes and treatments. Our first study looks at the endocrine and reproductive endocrine literature, where adult female acne is considered as a possible clinical expression of hyperandrogenism. Welcome, Dr. Yadav. What are your thoughts on adult female acne as a sign of underlying hormonal conditions such as polycystic ovary syndrome?
Hi, John, and thank you so much for the opportunity to chat with you about this really interesting and timely topic. Looking at the first article on female adult acne and androgen excess, I wanted to talk a little bit about some of the recommendations that came out of this report, really concerning patients who have polycystic ovary syndrome, and guidelines in terms of how you consider acne in this context as a disease of androgen excess. So some of the guidelines include recommending measurement of serum androgen values like total testosterone and free testosterone by high quality assays for all women with adult acne. The other was looking at considering addition of what they call estroprogestins, or oral contraceptives that have estrogen and progesterone in them, to topical and or systemic treatment of acne, independent of the severity. And the other recommendation that I found really interesting was that they looked at second and third generation estroprogestins also being able to be used independent of the estrogen dose and the progestin component. And I often recommend to family doctors that they should use fourth generation oral contraceptives that have anti-androgenic progesterones. But in this paper, it's kind of going back to suggesting that all second and third generation estroprogestins can be used in the context of adult acne in the setting of androgen excess.
Our next study looks at a novel topical therapy to target the hormonal pathogenesis of acne. In two identical phase 3 trials, clascoterone showed favorable efficacy over placebo in treating acne. What's your take on this study, Dr. Yadav?
Well, I think it's super exciting to consider a topical anti-androgenic therapy in acne. We don't have anything like it right now. We often have to use systemic treatment when trying hormonal therapies or anti-androgenic therapies in patients who have acne. And that comes with a host of other side effects, including some of the other conditions that people experience with the hormonal therapy. Sometimes patients complain of weight gain, they can complain of mood disturbance. And so when you're looking at a topical treatment for a condition that we know is related to androgen excess, it's really exciting to be able to offer a new kind of category of treatment for patients. We don't have this approved in Canada yet, and this paper looks at these phase 3 trials, but I think it's promising, and we hope to see it come out in Canada in the coming year or so.
Our last study today is a case report of a transgender boy who developed acne fulminans after an increase in his testosterone dosage. Dr. Yadav, what are your thoughts on managing acne as a side effect of hormone treatments?
I think this is an important discussion to have today, especially as I think society as a whole becomes much more sensitive to the issues surrounding diversity and inclusion and equity in the workplace, and also carrying through in the clinical care we provide. One of the adverse effects of testosterone therapy certainly has been well established as being the worsening of acne, and can typically kind of peak at around 6 months of therapy. I think what's most important when treating patients who are taking exogenous androgens or hormone therapy in this context is to start low and slow in terms of scaling up dose levels. And in terms of a setting of acne fulminans, in this case report, treatment for acne fulminans was similar to what we would do in patients who are not on testosterone therapy. We do see acne fulminans, most typically in the kind of 19-year-old male type of patient population. And certainly using acute management that sort of quickly and rapidly gets the inflammation under control, such as oral steroids or low-dose isotretinoin, rather than topicals or antibiotics, is fairly standard care. So I think one kind of key takeaway would be that, even in cases of transgender people who are taking testosterone, it's important to kind of remember to treat patients the way you would in any context of that disease presentation, and to kind of follow your clinical practice in that setting. To get another perspective on today's topic, we reached out to Dr. Renita Ahluwalia. Dr. Ahluwalia is an incredible dermatologist, a good friend, and the lead dermatologist at the Canadian Dermatology Centre in Toronto. She has presented at national and international meetings and is a lecturer at the University of Toronto. I always enjoy hearing Dr. Ahluwalia speak, and I'd like to turn it over to her at this stage to give us a little bit more context for our topic today. Dr. Ahluwalia, what's been your experience managing patients with hormonal acne?
Well, the first thing is that I want my patients to know they are not alone. Hormonal acne is on the rise. It affects a lot of women between age 20 and 40, sometimes younger, sometimes older. I have patients coming into my office every day saying, "Why now? I didn't have acne when I was younger. I had perfect skin." I want them to know they're not alone. 65% of women deal with it. Often they get painful lesions around their jawline that flare with their menstrual cycle. And there's very specific treatments that we can do to help these patients. So I want patients and practitioners to know that we can tailor treatment for this specific condition through certain oral contraceptive pills or through anti-androgen medications like spironolactone, which can make a big difference.
We turn now to a segment where we discuss acne myths and trends that are prevalent on social media. The first comes from AD Puzzleheaded on Reddit. This person says they had acne that was diagnosed as being hormonal, but that the acne disappeared when they removed artificial sweeteners from their diet. Dr. Yadav, what are your thoughts on that?
I often hear from patients that their skin condition changes when they change their diet. That is something that happens about 10 times a day in my clinical practice. Unfortunately, I don't think it's quite that simple. The data about the linkages between food and acne are pretty tenuous. They're not really well established. There is some thinking that food that has high glycemic index can be sort of a stressor for acne, an exacerbator of acne. But I kind of reserve recommendations around dietary change only to people with the most severe cases, because the data is sort of fairly thin and it may be more likely that it's a coincidence. I picked up a line from one of my mentors at Sunnybrook Hospital when I was training there, saying that he wished he could kind of walk around his clinic with a t-shirt that said, "It's not food." And I echo that, when I think of this kind of commentary, because often it's not food, though many people think it is when it comes to dermatologic conditions.
On a similar food note, Holistically Healthy Skin on TikTok suggests that eating a raw carrot daily can prevent hormonal acne in women specifically. She says it can remove excess estrogen. What would you say to that?
I think there's a bunch of stuff here that doesn't make a lot of sense. I'm kind of assuming the extension of thought between carrots and retinoids and retinols and retinoic acid, which is sort of a big stretch in terms of conversion, in terms of efficacy against acne, because we do know that isotretinoin, which is a vitamin A kind of analog, and topical retinoids are standards of care in acne, but they don't work by removing excess estrogen. And acne itself is not an estrogenic condition. So we consider it sort of either a condition of androgenic excess or androgenic hypersensitivity. We see pathology associated with excessive carotenoid ingestion. So people who eat a lot of carrots may end up with orange palms. And so I would say that the logic here, the physiology, it doesn't all add up. And I wouldn't recommend this as a treatment for acne.
And our last social media entry for today, a Verpa on Reddit writes that switching to a ketogenic diet helped clear up their acne. Again, you've already mentioned it's not diet, but how much truth might there be to a ketogenic diet in particular having an impact on breakouts?
It may be, again, if I'm being as charitable as possible, that some of these dietary changes do kind of act at that high end of lowering your high glycemic food index foods, which can possibly be linked to acne. But I think as a mainstay of treatment, there's better ways to do it than change your entire diet, and certainly ways that are more enjoyable than going to the lengths of changing entire dietary structure to deal with acne. We've got much more efficacious products, from over the counter to prescription, that can deliver far better results than anything, diet could manage, even if you believe that diet could manage it. And I think, what I often also say to patients when they come to me and say, oh, but I've done this and I think it's better, I sort of say to them, yeah, but you're still here with acne. So it clearly wasn't enough. And in that setting, we still need to do something. And if it's more enjoyable to do it with you keeping your existing diet, then, so be it.
Well, thank you very much, Dr. Yadav. Listeners, if you have comments or questions for Dr. Yadav, send them over. Send an email to health@chronicle.org and add a voice clip attachment to your questions, and you might appear in a future episode of this podcast. If you enjoyed this podcast, please share it with your colleagues. You can subscribe at Apple iTunes, Google Podcasts, Stitcher, or wherever you get your podcasts. This podcast was produced in cooperation with Cypher Pharmaceuticals Incorporated. I'm John Evans, Senior Editor at Chronicle Companies. Your host has been Dr. Geeta Yadav, Founder and Director of Skin Science Dermatology in Toronto, and a general medical and cosmetic dermatologist. We'll talk again next time.